Good evening, everyone. Today we will be looking at the outer ear, that is the pinna, and the external auditory canal. That will be the focus of today's discussions or lectures. The outer ear, which begins from the pinna, includes the external auditory meatus or external auditory canal, are the major part of the outer ear, while the inner ear begins with the tympanic membrane, inclusive of all the ossicles and the tympanic cavity, while the inner ear is the rest of the other parts, inclusive of semicircular canals, vestibular nerve, and facial nerve, and all of that, okay? But our focus for today is the pinna and the external auditory canal. The outer ear is the most external portion of the ear. The outer ear includes the pinna, also known as the auricle, the ear canal, okay, and the superficial layer of the ear drum, also known as the tympanic membrane. So these are the major parts of the external ear, okay? That's by way of introduction. Then let's look at the major parts. The pinna, this is the pinna. This pinna is made up of more of cartilage, as you can see. And in the further discussion in these lectures, you'll get to know about this. Then subcutaneous layers, okay? This you are seeing is the petrous part of the temporal bone, okay? So when we describe the ear, say the ear has membranous and bony what? Path, okay? But the pinna has more of the cartilaginous part, okay? This is the cartilage, okay? And this is the external auditory meatus, okay? Which is one of the most functional parts. The major function of this external ear, the pinna, is to capture sound wave and concentrate it into the what? Middle ear and furtherance to the internal ear, inner ear. The auricle, also known as the pinna, is the visible part of the ear located on the outside of the head. It plays a crucial role in the auditory system by collecting sound waves and directing them into the ear canal. The auricle is made up of cartilage covered by skin. This is cartilage covered by a skin. It has a unique shape that helps in capturing and funneling sound waves to the inner ear. As you look at this pinna, you will see lots of intricate foldings. We're going to look at these intricate foldings. But the pinna as a whole is made up of more of cartilage that is covered by a thin layer of what? Skin, okay? This is the what? The pinna. It is made of the intricate folds and ridges of auricle. These foldings we are looking at here helps in localizing sound waves. So the way it's being shaped and placed is to concentrate sound wave in here, to concentrate sound wave here so that air can vibrate here and generate a wave motion inside the perilymph of the inner ear. So these intricate foldings are essential for localization of sound waves. Now let's look at these foldings and their names. Now look at these are the fold. The number one we have here is the superior crus of the antihelix. This is the antihelix. This is the antihelix. Okay, this is the antihelix. This is the helix. This folding here is the helix. This folding here is the helix. Then looking at here, you will see the cruise of antihelix. Then you see the major antihelix. Okay, so this is the helix, this is the antihelix, this is the, this is the cruise of antihelix, and this is the antihelix proper, or the stem of antihelix. Then inferiorly here, you see the antitragus. This is the tragus. Okay, so it's known as the anti-what? Antitragus. Now, this is the helix. This is the cruise of antihelix. This is the antihelix proper. Then, opposite it is a depression that is upper, known as a cymba, and the down one, known as a cavum. Okay, this is the lobe, and this is the incisura, and this is the ear canal, the opening. Then this is the cruise of the helix. Look at the helix. This is the helix now. Everything here, this rim is the helix. This is the cruise of the helix. This is the superior cruise of the antihelix. This is the helix. This is the antihelix. So this is the cruise of antihelix. This is the cruise of the helix proper. This is the lobe. This is the antitragus that is facing the tragus. And this is the incisura. And this is these two depressions are known as cymba and cavum. Okay, that's the two. Now, there are two aspects of the auricle. There are two aspects of the auricle. We have the medial, or also call it the inner. We also have the lateral, also known as the outer. There are two aspects of the auricle. We have the medial, known as the inner, and the lateral, known as the outer. The medial aspect of the ear lobe is attached to the skull. That is, the part that is nearest to the skull, where the ear is at, the pinna is attached to the skull, is known as the medial aspect. Okay, known as the, whereas the ear flag you are seeing is known as the lateral part of the ear, or the outer pinna. Now, we've been able to look at the helix. So the helix is the prominent outer rim of the pinna that gives the ear its characteristic shape. And this is the helix. This is the helix. I started here, here, here. So it has its cruise here. Okay, but this is the antihelix. Okay, this is the tragus. This is the tragus, and this is the antitragus. Those are lobe. So we have the antihelix. The antihelix is the inner curved ridge located parallel to the what? To the what? Helix. It's located parallel to the what? Helix. So this is the helix. This is the antihelix. Okay, antihelix, and it terminates here where the antitragus originates. Okay. Now we have the tragus. The tragus is the small triangular shaped flap of cartilage located in front of the ear canal. This is the ear canal, and this is the tragus. Okay, it helps in protecting the ear canal from foreign objects and can also aid in sound localization. We've said about the antitragus. The antitragus is, this is the antitragus, is a small protrusion of cartilage opposite the what? The tragus. The exact function is not fully understood. Then we have the ear lobe. The ear lobe is the soft, fleshy lower part of the pinna. Oh, it doesn't have a direct role in hearing. Okay. Now let's look at the sizes of the pinna. There are various sizes of the pinna. Different individuals have different sizes of what? Pinna. Okay. Some people's own can be larger and more prominent, while others may have smaller or less noticeable what? Pinnas. However, the size of the pinna is generally proportional to the size of the head. Okay, with variations in size and shape, adding to the uniqueness of each person's appearance. So the type of ear the person have are proportional to his head, make up the person's, how the person will look, like the appearance of the person, whether the person will look okay, look well, and all of that. Okay. Now let's look at the artery supply and venous drainage of the pinna. You know, the pinna is a living structure, so therefore have blood supply and also have blood drainage and also lymph drainage and also have innervations. That is why if you pierce it, it gives you pain. Without the blood supply, it will die. It will die out of ischemia or neurosis. Now let's look at this diagram here proper. This is the common carotid artery. Common carotid, we're not talking about the artery, that is the blood vessel that supply blood to the pinna. Now, the branch of the common carotid artery is the supply. And this common carotid artery branch off from the brachiocephalic. Okay? Okay? So, directly from the aorta. So it now branches into two places. We have the carotid, the internal carotid. This is the internal carotid. This is the internal carotid. Then this is the external carotid. This is the internal carotid artery. This is the external carotid artery. So from the branches of the external carotid and the internal carotid, the pinna is supplied. In fact, the whole part of the ear is supplied with blood. So now look at, this is the external carotid here. Look at it here. External carotid branches off to form the auricular artery. So the ear, the pinna receives blood through the auricular artery, and the auricular artery is a branch from the external carotid artery. So it supplies the posterior part of the ear. This is the branch. Then also the carotid artery, external carotid artery, branches off also further to form the anterior auricular arteries that supply the tragus, the antitragus. Look at it here, supply the tragus, the antitragus. It supplies even the external auditory canal. It supplies the crus of the helix. Okay. So then, whereas the posterior auricular artery supplies other parts of the ear. Okay. So the blood supply and venous drainage of the pinna or auricle involves a network of arteries and veins that provide oxygen and nutrients to the tissue of the ear and removes waste products. So we say that the major supply is from the external carotid artery, where it branches off to posterior auricular artery and anterior auricular arteries. Okay, so other branches, because if you look at here, these are also some branches. This one is from also branch from the temporal part of the skull. This is this particular vessel. So therefore, superficial temporal artery also supplies. So it has to tell us that the main artery that supplies blood to the pinna is the superficial temporal artery. That is this one. You can see the branches here branching off. Is the superficial temporal artery, which is also a branch of the external carotid artery. It travels along the side of the head and gives off smaller branches that supply blood to the external ear structures, including the pinna. Then we also have the posterior auricular artery, which we have which is also a branch of the external carotid artery, also supplies the ear. Then also another artery is the occipital artery, which is also another branch of the external carotid artery. It also supplies the pinna with blood. Now let's look at venous drainage. How is this deoxygenated blood? You know, the oxygenated blood brings the oxygen and nutrients to the ear, while the veins drain the deoxygenated blood, drains the deoxygenated blood, and remove waste products from the blood. Now, the venous drainage is through the superficial temporal vein and the posterior. So the posterior superficial temporal vein, posterior auricular vein, and external jugular vein are the major drainage system for the pinna. Okay, they're the major drainage for the pinna. So look at here now. This is the subclavian vein, which is a branch off from the superior vena cava. Okay, and now it enters the vein, the external jugular vein. This external jugular vein now branches off to posterior external jugular vein and the oblique jugular vein. From the oblique jugular vein, the branches known as a superficial temporal vein, posterior auricular vein, and external jugular vein all now drain blood, deoxygenated blood, out from the pinna. The lymphatic drainage. The lymphatic drainage of the pinna involves lymphatic vessels that helps to remove excess fluid and waste product from the tissue. There are lots of lymph nodes around here, around this place, okay, of every human. There are lots of lymphatic nodes. So when these lymphatic vessels drain this excess fluid, it is through the lymphatic node and its tributaries that it's returned to the left side of the heart. Right side of the heart, please. So these lymph nodes located around the ear, such as the periauricular and parotid lymph nodes, play a role in draining lymph from the pinna. Okay. So what is the clinical relevance of us knowing about this, about the arterial supply, venous drainage, and lymphatic drainage? One is, when we understand the blood supply and venous drainage of the pinna, it becomes important when we perform some certain medical procedures, such as reconstructive surgery, trauma management, burn management of the ear, treating conditions affecting the ear. Because we know that if there is disruption of the blood supply to any part of this ear from these tributaries or vessels, it can lead to complications such as tissue necrosis, and therefore that section of the ear might begin to die, or even the procedure might not really work out because the blood provides the essentials for every living tissue. So we therefore have to maintain adequate blood flow so that the pinna will be healthy and function very well. Now let's look at the innervation. How is the ear? How do you feel the pain? What nerves are responsible for the pain you feel in any part of the ear? There are two major sources of innervation for the ear. One is the trigeminal nerve 5 and the facial nerve 7. Trigeminal nerve 5 and facial nerve 7. The trigeminal branches off in form of auriculotemporal nerve. We have auriculotemporal vein, we have posterior superior auricular artery. Everything auricular talks about the ear. That's a branch off from the major sources, okay? So the auriculotemporal nerve, this is the auriculotemporal nerve, you see it, is the one that innervates the the upper part of the helix, anti-helix, the half of it, whereas the greater auricular nerve innervates the lobule, the helix, the inferior part of the pinna. Okay, so it says the auriculotemporal nerve, which is a branch of the mandibular division of the trigeminal nerve, provides sensory innervation to the skin of the anterior part of the pinna. It carries sensation information from the anterior and superior part of the pinna. I say this is the anterior part, this is the superior. So that is the auriculotemporal nerve. So the auriculotemporal nerve is responsible for innervation of the anterior here, anterior and the superior part of the pinna. Whereas the facial nerve, which branches off in form of greater auricular nerve, which branches off from cervical plexus, carries sensory fibers from the posterior part of the pinna. The facial nerve also provides motor innervation to the muscles of the pinna, which helps in moving and adjusting the position of ear. Yeah, you saw some persons, they have the ability to move their ear, like the dogs. Some people have the ability to move their ear. It is being done by the help of this facial nerve 7, okay, which innervates the lower part. So the greater auricular nerve. So this is how the ear receives its innervation, and blood supply and lymph drainage. If you look at this picture here, you see the painting. The yellow one painted is the facial nerve. That facial nerve also innervates the external auditory canal. The blue one is the greater auricular. See the greater auricular here. Then the green one is the auriculotemporal. Auriculotemporal, which is the trigeminal nerve, also is the one that innervates here. Then lesser occipital nerve. So also somehow the occipital nerve also contributes to innervation of the pinna. Now let's look at the cartilaginous makeup of the pinna. The pinna is primarily composed of cartilage, which is a flexible and durable connective tissue that gives it its shape and structure. The cartilage of the pinna is elastic, allowing it to maintain its shape while also being flexible enough to withstand minor deformations without permanent damage. So the cartilage is a bit elastic. And also, there is a supportive framework. The cartilaginous framework of the pinna provides support for various curves and folds that make up its unique anatomy. Those anti-helix, helix, tragus, and all of that, it is made possible by the help of this cartilaginous structure of the pinna. They're sensitive. The cartilage of the pinna is sensitive to touch and pressure, which contributes to its role in detecting and localization of sounds in the environment. Now let's look at the general functions of pinna. The primary function of the pinna or the auricle is to collect sound waves from the environment and guide them into the inner ear canal. It acts as a natural amplifier, enhancing the reception of sound and improving the ability to perceive different frequencies and volume. So with the help of the pinna, we can say this sound is too loud because it's the one that concentrates the wave into the ear canal. Sound localization. The shape and structure of the auricle are essential for sound localization, which is the brain's ability to determine the direction from which a sound is coming. So the pinna helps us to know whether the sound is coming from the back or the sound is coming from forward. Okay, so that's another function that the pinna does. Okay, then protection. The auricle also plays a role in the ear canal and eardrum from foreign objects, dust, and insects. Okay, it acts as a barrier preventing debris from entering the delicate inner structure of the ear. Okay, the another function of the pinna is aesthetic and cultural significance. In addition to its functional role, the auricle has aesthetic and cultural significance in many societies. It is often considered a feature of beauty, women, It's in some of the cultures, it's where adorned with jewelries or accessories as a form of self-worth expression. So ear is performed that aesthetic function. And also ear contributes to our individual uniqueness and what appearance. So these are the of the ear of the pinna, not the ear, the pinna. 1, sound localization. 2, sound collation, sound wave collection from the environment and guiding them into the ear canal. 3, protection of the ear canal. 4, it contributes to individual variation in appearance. 5th one, it contributes to aesthetic and cultural significance. Now let's look at clinical significance of the pinna. 1, why do you think it's of interest why we study it? One of the importance now, one of the clinical significance is that when we understand the structure of the ear, we now determine the size of speculum that we can use. When we appreciate this, we know that different people have different ear canal sizes. So we'll now use the appropriate size of ear speculum to examine their ear without injuring them. Also, for persons who are having hard of hearing or who require hearing aids, the shape and size of the pinna are important factors to consider when fitting hearing aids or other assistive devices. Okay, because when these are not properly done, the effectiveness of those devices and for the comfort of the individual will not be there. So that's one of the clinical significance of us understanding that different pinna sizes and different structure, different shapes, and all of that is important for our understanding so that we find the best fitting assistive device or speculum for our patients. Then developmental abnormalities. So if we don't have idea of the variation in size, we might not be able to identify developmental issues or congenital malformations of the pinna, such as microtear, which is an underdeveloped pinna, or anatear, absence of a pinna, which can impact in their ability of the individual to hear. Take, for example, we always say that the pinna plays a role in sound localization, protection, so, and wave identification. Now, if we don't have this basic knowledge, someone whose ear flag or pinna is not okay, we might not understand that it could be a contributing factor to the person's hard of hearing. So clinically, it's relevant. We appreciate this. The next is ear infections. The pinna's anatomy, including its cartilage skin, can make it susceptible to various skin conditions and infections. So understanding the structure of the pinna is essential for diagnosing and treatment of conditions like otitis media or auricular hematoma. Okay, it's very, very what. But also in some certain surgery, it's important we know that this part of the ear is being innervated by. So for us to improve supply and all of that, we'll have to take cognizance of that. Now let's look at another structure of the ear known as the external auditory canal or external acoustic meatus. This is the external auditory canal. This is the green part. It starts here. It's of 2 regions. You have the membranous and the bony. This is the bone. You can feel the bone here. This is the bones. This is the bony part of it, and it's not straight. And this is the cartilaginous section with membrane. This is membranes. There's a cartilaginous section. This is cartilages, and this is bone. So it has 2 sections, 2 parts. The cartilaginous part, which is a continuation of the cartilage from the pinna, and we have the and bony part. And this inside of this is lined with hairs that perform many functions and also secrete the cerumen, which is of bacterial action. The external auditory canal, also known as the ear canal, is a tube-like structure that extends from the outer ear to the eardrum. This is the eardrum. It is a bony cartilaginous canal that projects from the auricle to the middle ear, from which it is separated by the tympanic membrane. This is the tympanic membrane. The external acoustic meatus consists of the lateral, which is the outer. This is the lateral, the outer part. This is the outer part of the pinna. This is the medial part of the pinna. This is the lateral part of the EAC, and this is the medial part of the EAC. So the external acoustic meatus consists of the lateral cartilaginous parts. See, that's the cartilaginous part, lateral, referred to as the cartilaginous or membranous external acoustic meatus, and the medial or the inner, this is the medial part, called the bony external acoustic meatus. Look at it here, parts. Okay, this is here. This is the membranous and cartilaginous. This is the bony part. Okay. So the lateral part, this is the outer opening of the canal. We already said it's the outer opening of the canal, known as the external acoustic meatus. Okay, it is posteriorly superior. You see, it is posteriorly superior. Okay. This membranous external acoustic meatus makes up the lateral 1/3 of the canal. You can agree with that. Look at it. It takes a greater portion. Look, from here, it's all about membranous. Okay. It is anterior and inferior. Its anterior and inferior walls are made up of cartilage because it is a continuation of the auricle. We said that. Then the medial part, which is the bony part, starts from here and is more of what. In another part is the isthmus, which is the narrowest part of the canal where the cartilaginous and bony portion meet. Look at it. This is the isthmus. Look at the cartilaginous here. Look at the cartilaginous here. Look at the bone. So here they meet is known as the isthmus. Okay, isthmus part of the external auditory canal. Then lastly is the hairs. There are hairs. Look at the hairs here. And the ceruminous gland. These structures are present in the canal and plays a role in maintaining ear health. Now, what is the length of the external auditory canal? It varies in length individually, but typically measures around 2.5 cm to 3 cm in adults. This length differs based on age and anatomical variations. This external acoustic meatus has two layers, the outer layer known as the cartilaginous portion and the inner portion. We've discussed that. Now, what are the functions of the EAC? Sound transmission. The external auditory canal acts as a pathway for sound waves to travel from the outer ear to the middle ear. So when the pinna concentrates the sound into the external auditory canal, the external auditory canal will now push it into the middle ear. Protection. The EAC also helps to protect the delicate structure of the middle ear, such as the eardrum, the ossicular bones, as we're going to say in other lectures. So you find that it's very sensitive. That's how you put something in the ear, you will jake because of the nerves, the auriculotemporal nerves and greater auricular nerves, and other branches of the both the trigeminal and facial and even the occipital nerves. Okay, that innervate. So it somehow protects the middle ear. Then the wax production. It is the skin that lines these canal that produces this cerumen. And this cerumen or ear wax helps to lubricate the ear canal and prevent the entry of foreign particles. Resonance. The shape and length of the canal contribute to sound resonance, enhancing the perception of certain frequency. Resonance is kind of an overtone, a form of echo. So it is the ear external auditory canal that helps to increase the sound what? Resonance. Blood supply. The arterial blood supply is through the external auditory canal. The arterial blood supply, the external auditory canal, comes from the branches of the external carotid artery via the posterior auricular artery, like we explained earlier, and other branches of the auricular arteries too. Then the venous drainage. The venous drainage is also through the posterior auricular vein, like we explained before, which now drains directly into the external jugular vein. While the lymphatic drainage is also from the superficial parotid lymph nodes and deep cervical lymph nodes. Okay. What are the clinical significance of us studying this external auditory canal? We said that clinical significance refers to the practical importance or relevance of that particular findings in clinical or medical context. Of what importance is it? You know, ear infection. From the knowledge so far we've gathered, we find out that otitis media, otitis external, that is the swimmer's ear, commonly affect the external auditory canal skin caused by bacteria and fungi, and therefore can lead to pain, swelling, discharge. Okay, so when someone complains of ear pain, we begin to think of it could be swimmer's ear, which is now affecting the external auditory canal. Now, from our medical knowledge, from the clinical knowledge, if the external auditory canal have an issue, it can probably also present with pain because there's nerves. There's nerves innervating that, so it can probably present with pain. And also, it can also probably present with excited secretions because it already has blood supply. So inflammation is possible. Also, we also have to understand that it can also reduce hearing acuity. Another clinical relevance is impacted earwax. Excessive buildup of earwax cerumen in the external auditory canal can lead to hearing loss. Discomfort, and even what? Infection. So therefore, regular cleaning or removal of this is important. Then foreign bodies. From clinical knowledge, we've come to realize that foreign bodies like beads, insects, or cotton woods swabs can accidentally get lodged in the external auditory canal because the external auditory canal is not that straight. You see, from what we studied so far, I found out that it is somehow not straight. Then objects can lodge there, which can cause pain, hearing loss, and even damage the eardrum. Then traumas. Traumas can also affect it, such as laceration, burns can occur due to accident or fall, or even insertion of sharp objects. Tumors and growths can also occur in that areas. Then cholestomia, which is a non-cancerous skin growth in the middle ear or in the mastoid bone that can extend to the external auditory canal, can cause hearing loss, dizziness, and recurrent ear infection if left untreated. So see how we are trying to broaden our clinical understanding of the study of the EAC. Then barotraumas. Barotraumas, that is, which is as a result of changes in pressure, such as dive during air travel, can lead to barotrauma in the external auditory canal, which can cause pain, fullness, or even eardrum perforation. So therefore, proper equalization technique can help prevent this condition. So this, from the clinical point of view, we understand that barotraumas can damage the eardrum. And so therefore, safety measures are put for those who are taking flights or who want to travel to the moon through to the space. Then hearing loss. From our clinical understanding, we've come to realize that some certain conditions that can affect the EAC can be the leading cause of ear deafness or deafness. Okay, and which probably can lead to hearing loss. In fact, an infection that is established at the skin of the external auditory canal can move to the point it can rupture the eardrum. And also from our knowledge of how the structure is, we now understand that insects too can go there and block. And therefore, it has informed the techniques used for removal of some certain objects that may lodge in the ear in order not to damage the eardrum or the ESC. So from this course so far, the external part of the ear, we've been able to look at the pinna, look at the structure of the pinna, the function, the blood supply, the lymph drainage, and all of that. And we went forward to look at the EAC, external auditory canal, where we also look at the structure, the parts, the functions, the blood drainage system, the supply, the lymph node drainage system, the innervations, the functions, and the clinical what relevance. With this, we've been able to look at the external ear, and we'll be able to look at the pinna and the external auditory canal. Thank you.